Thanks for watching this week's video from Neva Health. Today you're going to learn about knee pain. But before we do that, hit the subscribe button in the corner and then tap the bell so you can stay up to date every time we post a new video on our channel. So are you dealing with some sort of knee pain and wondering, what do I do? How do I get this taken care of? I'm just going to take you on a little journey of basically, what you can expect when you're dealing with knee pain. A lot of times it'll start when you're, maybe age 30, 40. And a lot of times that can be resolved through physical therapy, maybe taking, an NSAID, an over-the-counter pain reliever, and a lot of times it'll go away. What happens as you continue to age, and especially in athletes or people that are really active, you got to remember that the average person takes 10,000 steps in a day. And when you're doing that, think about what's happening to your knee joint, right? It's constantly getting, and you do that 10,000 times a day for, how many years? Eventually there's going to be a cartilage space in there that's going to wear down. So when you feel any sort of knee pain, pain equals inflammation. That tells us that something isn't right. Maybe you tweaked a ligament, or you were walking with a heavy backpack, or you're carrying a lot of heavy stuff. That adds even more pressure to your knees. And so knees are one of the most common things that are replaced through surgery. And the reason for that, it's not that knees are anything different. It's just that if you think about when you're walking, where does all the pressure go? So they go from your ankles to your knees and your hips. So the first thing to go just so happens to be knees. That's why you keep hearing about all these knee replacements. Well, let me take you through the journey of how people actually get there as far as the knee replacement goes. Well, after you've tried the physical therapy and it's worked, let's just say you try it again and you all of a sudden you notice, what? The pain's not going away. My knee pain is constantly there. It's always there. It's affecting how I walk or how I run, and it's not getting taken care of. So then the next level from that, when the painkillers aren't working, the physical therapy isn't working, what does your doctor typically do? Well, the first thing they'll try to do is actually adjust your medication. They'll give you a different painkiller, okay? And I'm not a huge fan of pain medications. I don't know if you are. I don't know anybody who really is, who wants to take that stuff, but because of all the side effects, right? It's going to affect your liver. It's going to affect your kidneys. It's going to cause you to gain weight and do all these things, and more weight equals more knee pain, right? So the first thing we encourage our patients to do, and most doctors, is lose weight. You take some pressure off your knees by losing some weight, but then maybe that doesn't fix the problem, right? So what's the next progression? Well, let me take you on this basically journey that you'll typically receive at a typical medical practice. And so a lot of times the next progression is what's called a cortisone shot. And this is a corticosteroid injection. What this is designed to do is it is designed to remove inflammation from your joint, okay? So what I want you to ask yourself is, why is the inflammation there in the first place? Well, the inflammation's there because you've got some sort of a dysfunction, right? There's the inflammatory response, and that inflammatory response just basically says that something isn't right, okay? That inflammatory response also releases pain. That's why you experience the symptom of pain, right? Pain is your body trying to tell you, hey, something isn't right, right? And the inflammation is actually designed, our bodies are designed to be super healers, right? We're supposed to heal ourselves, right? That's how biology and that's how human beings are, right? You cut yourself, there's inflammation, your body, you don't think about it, right? Your body just automatically knows what to do. And what does it actually do? So your body will actually send growth factors to the area where there's a problem and start to repair, right? It takes your body's DNA and it says, oh, I know it. That's a skin cell. I got to fix it. That's a blood cell. I got to fix it. That's a nerve cell. I got to fix it. Same thing happens with your knees, right? If you tear a ligament or you start damaging your cartilage, if you're young and you're healthy, your body's got inflammation. It sends the growth factors over. It repairs it. Everything's fine. You're back. You're back on enjoying your life, doing whatever you're doing. But as you start to get older, as your cells start to get older, that inflammation and the growth factors that are attracted to that inflammation, they no longer respond the way they used to when you were younger. So your body is not able to really fix the problem like it used to fix it. And so that pain is nagging and it's frustrating. And what a lot of doctors' offices do, we don't do this at our office, but a lot of offices will do what we call cortisone shots. And those cortisone shots, they remove the inflammation, they get the inflammation out of there. But here's the thing that, maybe some doctors won't tell you about cortisone shots. If you do some research and you do some homework, there's some very prominent medical universities out there that educate that you should not have more than one cortisone shot in one area of your body in your lifetime, okay? Which is, unbelievable, because I've seen people come into our office where they've gotten, 10 cortisone shots in their lifetime. Now, let me explain to you what cortisone does. When you inject cortisone into your knee, what that's doing is it removes the inflammation. Well, remember, the inflammation was there for a reason. It had a purpose. It's there to help you fix the problem. So if you remove that inflammation, what do you think is actually going to happen to your knee, right? If any of you guys want to comment below and let us know what you think is going to happen to your knee with cortisone, or if you've had cortisone and you've seen what happens to your knee, let us know, because I'm about to kind of spoil that for you and tell you right now. What happens to your knee is, since the inflammation is no longer there, your body can't heal from that problem anymore. So it actually does the opposite, okay, of what your body's trying to do. So instead of regenerating the damage, instead of an anti-aging process naturally occurring in your body, it does the opposite. It degenerates your knee. So it actually causes your joint to age much, much faster than it would normally. And that's why anytime, there's a lot of side effects to cortisone injections. Anytime you get a cortisone injection, you will actually fill out something called an informed consent. And on that informed consent is where it tells you all the risks that you're going through by going through with the procedure. And if you actually read that, it will say that, there's a lot of risks associated with it. But, one of the main risks is basically necrosis. Necrosis means death. Right? So death of the bone, death of the cartilage. So you're actually destroying your joints for this temporary little relief of pain that you're getting. And so what is that? So now let's fast forward, right? You've gotten this cortisone shot, you've gotten some relief, but then what happens? 6 months, 9 months later, all of a sudden your pain is back, right? And it's worse than it was the first time, because now you have less cartilage, right? Because you have more degeneration, because your joint's actually older. If you put your knee joint compared to somebody else's knee joint who didn't get a cortisone shot, guess what? Your joint looks like it's 5-10 years older than the person that hadn't got the cortisone shot. And you're in more pain than the person that hadn't got the cortisone shot. So to me, it's a little bit of insanity. And that's why we do what we do, because we don't want you to make bad decisions. We want you to make the right decisions for your health. Everything that we offer our patients at Neva Health is the same thing that I offer my family, that I do on myself. If it's not good enough for my family or for myself, I'm not going to offer it to another customer. That's just not how we operate. And that's the first thing when I became a doctor, I took the Hippocratic Oath: do no harm. And I also live by the golden rule, which means do unto others as you want others to do unto you. Thanks for watching today. If you have questions or comments, post below. Dr. Foss here, and I want you to live your best life.